Good morning, Dr. Sergienko. How are you doing this morning?
Doing well yourself.
I'm doing pretty good. So, have you got any advice or message you want to share for us this morning?
Well, just a quick update and then, a little bit of thoughts about as we transition from this pandemic as a public health emergency to a pandemic with effective countermeasures. So, what we're seeing right now is we're continuing to have a high rate of transmission within the county. And a large number of cases, but that's really not reflecting in hospitalization or severe outcomes, so we're thankful for that. The two sort of clusters that we're keeping an eye on is the Ewing Wing at John C. Fremont. That's coming largely under control, and that's in large part due to the efforts of John C. Fremont staff, and they are getting some support from us in both terms of planning. We're helping out their incident command team with planning, and we're also helping with finding staffing through contract agencies. So those two things have allowed us to support JCF as they get a handle on this. And things are getting fairly close back to normal at John C. Fremont. The other place that we're looking at is within the schools, and the schools serving as a location for amplification of community transmission. So we're working with Jeff Aranguena and Becky Ballinger and the rest of the schools teams, asking that parents keep their kids at home when they're sick, think about testing their kids when they are sick, and potentially wearing a mask, or we may even have classrooms that close because of the significant amount of illness, though we have not gotten to that point yet. So be mindful that, again, the school's seeing a lot of cases there, but on the other hand, we're only a week and a bit away from schools coming to an end, so keeping an eye on that. So that's kind of what we're looking at for sort of the caseload in Mariposa County. And then, as I mentioned earlier, we are making that transition from a public health emergency to a pandemic where we have both effective vaccines to decrease the severity of disease and effective medications also to prevent hospitalization and death. Both of those require going out and accessing them. And so we've seen a large percentage of our population do that, but again, continue to encourage people that if they have not gotten vaccinated, that they do that. If they have gotten vaccinated, that if you're in one of those categories, 50 years and older, or younger than 50 and immunocompromised, that you should be getting boosted, that you're getting your second booster at this point in time. So that kind of leads me to another thought about recovery and thinking about the strains and stresses that has caused on our community. And I know we've talked about that before, but both in terms of individual stresses and strains, we have the ability as individuals to access help through our behavioral health clinicians here, or through your own primary care provider. If you need to access it here at Health and Human Services, our number is 966-2000, or through your primary care, however you arrange for that. So that's sort of the individual level stuff. And then as a community, I'd like to think that we are at the point where we want to think about moving towards recovery and thinking about how we reestablish those ties that we had, that connectedness we had post-Detweiler, post-Ferguson fires. So those are things to think about, not necessarily from a public health standpoint, but from a community standpoint. And so we'll be working with community partners on how we move forward on that. And that's pretty much the update this week, but open to any questions you might have.
So, how are you doing?
Doing okay. For me, we're coming into the summer, and that's, as you know, I'm a volunteer firefighter, so we're already seeing vegetation fires. And so that, putting on my other hat, asking people to think about being fire safe and creating a defensible space, I think those are important messages as well. And then also thinking about other communicable diseases that are out there and that people should be aware of. Influenza. We're seeing more influenza now than we've seen since the start of the pandemic, and I think that's largely due to a decrease in using of masks, decrease in social distancing, all those things that reduced COVID transmission also reduced influenza transmission. So we're seeing influenza and other respiratory diseases that are not COVID. Again, the basic message is stay home when you're sick. The other thing we're keeping an eye on, or the other two things we're keeping an eye on, is hepatitis A and strawberries. More to come on that. That's an evolving thing, as is monkeypox. That's an evolving thing. We have 3 cases in the state of California, and none here locally or even in adjacent counties. But we are maintaining awareness of that. Don't think that's going to become a big deal or a pandemic that COVID did, or COVID is, but it is something to be aware of and to be mindful of as we see it evolve throughout the world. I think that's probably how I'm doing.
Thank you very much.
You're welcome.
Appreciate your time, and be talking to you again soon.
All right, take care.
Bye-bye.